Obviously, there's lots of different exercises out there. The next exercise I want to get into is, this one's pretty common, so actually I would take note of this one. And I told this to a lot of clients, and I deal with a lot of clients that have this problem, is that, you know, as human beings, we're supposed to have our thumbs pointed forward, okay? You'll see a lot of guys specifically, you know, their shoulders are going to be internally rotated, okay? So they're going to come in like this. And why is that happening? That's happening because of our behaviors. You know, something as simple as sitting at a desk all day, or just doing a bunch of bench press, which guys like to do as well. But you know, women have this problem as well. So what we want to do is we want to open the shoulders up. Now, when we condition our muscles, all right, it will be able to help pull those shoulders back into that neutral position where your posture will, you know, set itself right. So having those shoulders, you know, square, sit back nice and tall with thumbs forward. So all you need to do is grab a band, and it can be any band. You just want light resistance. And what I'm going to do is I'm going to take this band, and you know, the tension is going to be different for everybody, so just kind of map it out yourself. And I'm going to make sure that my posture is in line, so a neutral spine, meaning I'm not arching as I'm doing this. And the first part of the motion is going to be scapular traction. So what's scapular traction? Scapular traction is the shoulder blades, so these two blades coming here together, retracting together. Now, as I retract, I'm going to externally rotate the shoulder. So you're not just retraction, scapular retraction, you're going to do external rotation, okay? So what we're doing is ultimately, shoulders are here, we're kind of conditioning the body to draw them back, okay? So I just take this band, okay, sit up nice and tall, and then I externally rotate and pinch my scapular blades together, okay? So my scapular blades are coming together, and then I externally rotate my shoulders and get that nice squeeze in the back. Now, if you're doing it correctly, you should feel your rhomboids kind of come alive here. And what you're doing is you're conditioning your muscles to be aware of what you're feeling. And when you're conditioning those muscles, you're basically going to be able to fire them. It's called neuromuscular connections. You're creating neuromuscular connections to your muscles so that you're able to use them and fire them on command. What am I talking about? Something simple as core, the TVA, very, very important muscle, the transverse abdominis. So some people can't even feel their TVA. They can't even feel that transverse, that deep, deep muscle, because they don't have that neuromuscular connection. And what I'm talking about is creating that neuromuscular connection so you could fire that through exercise. So that's why activation techniques are very important to incorporate when leading into exercise. It's something as simple as a glute too. You know, a lot of my clients have, you know, trouble firing their glutes, especially with the ladies, you know, quad dominant, and they just can't feel it. So, you know, I go through some glute activation exercises so they can feel that tension before going into their actual workout. So went a little off into a tangent there, but I just want to say that creating that neuromuscular pathway to that muscle is very important because you're able to utilize that muscle during exercise. So cervical spine, shoulders. Move into a thoracic. This one's pretty tricky, the thoracic spine, because you know you got your cervical spine and you got your thoracic spine right here. You know, I forgot where I picked this one up at, but you know, again, I want to talk about neuromuscular connection because it's very important here. So, you know, if you're arching up, okay, you're arching up, you're really using your lumbar spine, your rector spine, and you know, your lower back muscles that erect your spine. And what we want to do is we want to take that away. So, I'm going to lie face down, make sure that my head's neutral, okay, not turn to a side. And I want to arch my hips up in the air. Now, you're drawing that tailbone in there and you're kind of doing a pelvic tilt. Now with that pelvic tilt, you want to hold that. As you hold this position, okay, what I'm going to do is I'm going to draw my shoulders back, okay, without retraction, and I'm just trying to feel this in the middle part of my back. So right where I'm feeling this is right here, my thoracic spine. I go and I release. Now, you probably didn't see a lot of movement. Yeah, I mean, you're not going to get a lot of movement out of this. This is the thoracic spine. So what we're doing is trying to create that connection so that you feel it. And when you feel it, you're able to utilize this. You're going to get a little more mobility out of this. It's going to help with your thoracic mobility. So again, head's neutral. I draw my tailbone up. I keep my tailbone in the air. Then I go ahead and I draw back using the thoracic spine, the middle part of my back, okay? So I incorporate about 10 reps there. You could do that every day. So yeah, moving on. So yeah, thoracic spine. moving on to the lumbar spine. And the lumbar spine, this one's very tricky, guys, because the lumbar spine is usually where I get the most complaints, okay? You know, we got excessive, you know, lumbar curvature. And guys, the one way to get rid of that, the one way I would say to get rid of that is not only doing, you know, therapy for yourself, getting massages, you know, stretching out, static stretching, yoga, anything that you're getting relief out of, but also engaging your core, okay? What am I talking about? You know, initially when I said the transverse abdominis is getting that navel to come in, okay? And when you engage your core, you get rid of that arch, okay? It's gonna pull your spine, you know, neutral. And that's what you're looking for. That's how you should demonstrate your exercise. That's how you should exercise with a neutral spine. Although otherwise, injuries will occur. You know, you continue to do a back roll like this, all right? Something's gonna give. Maybe your QL, maybe your retrospine, something like that, is because we're compensating from these postural differences. So, guys, with the core, I mean, to feel your TA, to feel your transverse abdominis, I would actually just, you know, go through a couple exercises over here. You know, you got one where you're drawing your navel in, you're trying to create the biggest profile possible with your spine neutral to the glass. This one's difficult for people to do, especially if they have obstructions. Okay, but what I'm trying to do is create that neuromuscular pathway to my abs so my back doesn't take the workload upon exercise. What I mean is, when I'm doing something as simple as this, just holding a plank position, right, push-up position, I have to fire my abs. My abs need to be fired. Now, if I don't create that neuromuscular pathway initially, I won't be able to utilize that during exercise, and my back's gonna take it. And guess what? When this back's inflamed, it gets worse, 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 and worse. All right, another one for the TVA, guys, engaging your abs. I should leave you off with this last one. You know, my boot campers know this one, and you know, I practice it a lot, pretty beneficial. I'm gonna take my hands about 4 inches away from my knees. Now, when I'm here, I'm gonna arch my back up like a cat. So, as I'm arching my back up like a cat, I want to draw my navel in. I want to blow out all my air to the point that it's uncomfortable. So I go, and I get, and that's what I'm looking for. I'm looking for that intense feeling where your navel is kind of drawn in. You're trying to bring your belly button to your spine, okay? And with that motion, you should feel an intense deep contraction in your stomach. And if you're not feeling that, that's a problem. That means you're not able to utilize your core during exercise. Probably the most important thing I like to tell people is being able to utilize your core. So going through some of these activation techniques as well as some of these postural exercises to align yourself up. And when you align yourself up, you'll see that you'll start to feel better, and that exercise will become a lot more a lot more easy for you. And overall, you're gonna feel a lot of improvement, not over with your overall being, but you'll just feel better as a person. All right, guys, thank you for watching this video. If you want to see more, go ahead and chime in and suggest anything that you guys want to hear more about.